Hi, I'm Heidi, and I am the owner of Flawless Aesthetics here in Springfield, and today I'm going to go over Tirzepatide. So Tirzepatide is the generic, or we offer the compounded version, and you may hear of Mounjaro. So Mounjaro is the name brand of the medication. How we can, med spas in general, or other companies, offer compounded versions is because it's on the national shortage list. Ozempic, Wegovy, and Mounjaro are. So at this time, compounding pharmacies all around the world are able to make it, and then we are able to buy it, and we can also sell it to you and prescribe it if we are providers, nurse practitioners, and physicians. So that's how we can get it at a discounted price for now. At any time, if there's no longer a shortage, then we cannot provide it to sell it to you. It will only be available via the actual pharma, which is the one that has it now is Lilly. What is Tirzepatide? Tirzepatide is also the same class of medication, a GLP-1, as semaglutide. Everyone hears about semaglutide. So we have all these categories. So let's explain it a little bit. You have Wegovy and you have Ozempic. If you Google either one of them, in the parentheses, it says semaglutide. It's the same medication. They are just labeled for different diagnosis. So Ozempic is for diabetes. Wegovy is for weight loss. And Mounjaro, if you Google it, it has in parentheses Tirzepatide, which is the generic. And it can be used for diabetes as well as weight loss too. So we offer these because they have been proven to decrease weight, and in return, it's decreasing your risk of stroke, heart attack. There's also showing improvement in studies in kidney disease as well as inflammatory markers. So this medication is not going to go anywhere. It's been out for years. It's just getting the publicity it is now because people are losing a lot of weight on it with minimal side effects, and it's a great option for non-surgical. So when we talk about Tirzepatide itself, it has the same side effects as other GLPs. Your stomach is a muscle. It contracts to empty. And what it does is slowing that muscle down. When you slow it down, it slows the process of it going through. That's why it contracts, is to move food. So if it's not contracting, the food is going to stay in there. There's a certain percentage at each hour that your food leaves your stomach, and we are slowing that down. So the goal is when you go to eat lunch, you're going to eat maybe 50% or less because that meal from your breakfast is still going to be in there. So that's how it works. And then it also plays a role with the hormone in your stomach that is produced that tells your brain that you are hungry. So that it has two components, mechanical and chemical. So when you slow down the digestive tract, you can obviously have symptoms. From my experience personally and treating over hundreds of clients with semaglutide and Tirzepatide, it is manageable with the side effects as long as it's done slow and steady. And it's the least amount of medication to lose 1 to 2 pounds each week. If you're losing 2 pounds, the chances are you don't need to increase. You're just asking for more side effects. You want to lose your weight slow. That way you can maintain it and keep it off. So when you think about it, your stomach is slowing down. Therefore, you're going to have constipation. This is called peristalsis. You have 20 feet of small intestines and 6 feet of large. That peristalsis is what makes you have to have a bowel movement. So when that slows down, obviously you can have constipation. The thing with the constipation, we recommend that you drink a minimum of 64 ounces every day. I know that probably sounds like a lot for most of you, but that is what you should be drinking. You should have 30 grams of fiber a day as well. That's what the normal diet should include. Diet you can get from whole wheat cereals, oatmeal, fiber bars, and a lot of vegetables. So if you feel like you're not getting it or you don't like a lot of things that are high in fiber, you can always get fiber gummies or Metamucil and slowly increase it into your diet to 30 grams a day. Another good thing is probiotics. Probiotics, yes, there's lots of pills over the counter, but you can also get a Activia yogurt daily. Why I like Activia yogurt is because it's live, because it's kept cold, versus a pill that's been on a shelf for over a year. So water, fiber, probiotics are going to be the key to your diet. And if you're still having constipation, that's when you're going to need to probably increase other medications. One option is Miralax. It is a powder, and it gets confused a lot with Metamucil, but Miralax is the white with the purple top, and what you would do is you would slowly increase that into your diet or stool softeners and or laxatives. So we recommend, if you're not going to the bathroom in 2 to 3 days, you just need to give us a call and we can help you over the phone. The other most common side effect is nausea. So what happens is that food is sitting there and it's marinating with the acid. So most of the time, the nausea is a side effect of acid reflux. Acid reflux, you may not feel the burning, but you can also feel nausea. So we recommend using either Tums, Maalox, any over-the-counter medication antacid, and we recommend not eating 3 hours before going to bed, because when you lay down, that acid is more chance of getting higher and causing you that nausea. When I've taken the medication, or a lot of people, the nausea is bearable. It's kind of like a morning sickness. Your stomach is just upset. It's not that you want to vomit. The people that have vomited are usually because they are trying to eat out and drink at the same time. And that's one thing you might have to limit, is when you eat, you drink, wait a half hour in between, so that your stomach, it's just sitting there and it can digest one versus another. The other thing is alcohol. When people drink a lot of carbonation or chugging beer, chugging pop, carbonation, that is an illusion, and it can expand. Your stomach is like an accordion. It can expand it, and the fastest way out is going to be up. It's definitely not going to be down. So those are the 3 most common side effects. If you Google any medication, there's a long list. And we do have some clients that have had experienced other things, such as headache, fatigue. But you have to think, any diet that you do, your body is going through a dramatic change of decreasing calories, carbs, sugar, and those all impact it. I do recommend that you start a daily multivitamin that can help you through all of these changes of your body. The goal is to lose 1 to 2 pounds each week. And it is done, this Tirzepatide is a weekly subcutaneous injection. When we say subcutaneous, that means a fat injection. Fat is the back of your arm, your stomach, your leg. It's a very tiny needle, and the goal is anywhere you pinch, you can put it in. You will not feel the needle at all. We can either give you the Tirzepatide in office, or you can do mail order. We offer both of those, and that really helps you when you come in for accountability. Another person to say, hey, how many times did you eat out? Are you drinking 64 ounces? Because we wouldn't recommend necessarily going up if you're not working with the medication itself. So we ask you these things. Are you eating out? Are you limiting your rice, your pasta, your potatoes? I'm not saying go to keto and no carbs at all, but we've got to limit it and make life changes. The bread, pasta, they are just going to fill your stomach and expand it. The goal is to be on this medication a minimum of 3 months. That way, if and when you decide to stop it, you've shrunk your accordion, that stomach, that muscle. That way, you can keep that weight off. Just like anything, if you go back to the ways that you were doing, overeating, sitting there just because there's an extra piece of bread, eating it, your stomach's going to expand, and it's going to take more for you to get full. So of course, yes, anybody, they say, oh, I'm worried about gaining this all back. Well, if you go back to the same habits. So those habits we recommend is eating every 3 hours something small that fits in the palm of your hand, or like a yogurt cup. You need to have every 3 hours eating something: nuts, cheese, yogurt, beef jerky stick. giving your body, eating that, your body it's called your metabolism. It's going to know it's getting fed, and it will also burn the calories and the carbs, and it won't want to store it. So that's how our body is. When you talk about long-term for this Tirzepatide, it is safe. You can take Tirzepatide lifelong. Of course, most people don't. How you could cold turkey at any moment. What I personally recommend is the injection is every 7 days. So when you get to your goal weight or when you're ready to stop it, I recommend that you go every 10 days and then every 14 days for a few injections. And once you haven't gained any weight, then slowly decrease the dose. So the dose for Tirzepatide is 2.5 milligrams, 5 milligrams, 7.5 milligrams, 10, 12.5 milligrams, and then 15 milligrams. When you talk about this in comparison to semaglutide, I think semaglutide has a great place for the majority of people. People that are very stubborn, that have maxed out on semaglutide and been on it for months and months at the maximum dose, or people who have severe diseases like heart disease, stroke, and complicated diabetes with the risk of kidney disease, they may need to be on something more aggressive like Tirzepatide. So I feel like Tirzepatide can help people once they're maxed out at semaglutide and they've been on it a while. It kind of gives you that flip and gives you a little bit more weight loss that you need to get over a plateau. So statistically, people with Tirzepatide do lose more weight, but it is more expensive. So I do recommend starting out with semaglutide and getting your lifestyle and your changes done before switching to something more expensive, because it does work well as well. There are some contraindications that you can, if you aren't able to do, if you wanted to do Tirzepatide, and it is the same as any GLP. You cannot be pregnant. You cannot be breastfeeding. We do recommend a second line of birth control because they're called those Ozempic babies. People who've had fertility issues, PCOS, are now realizing they dropped 20 pounds and they are getting pregnant, even if they're saying, I will never get pregnant. They told me that I couldn't. We are seeing people get pregnant. So we do recommend that you do use a second form of birth control at any age, even if you think you can't get pregnant. The next one is going to be pancreatitis. So your pancreas, this medication has gone through your pancreas, and if you've had pancreatitis, we don't want to hinder it any more than it is, especially if you have diabetes and uncontrolled diabetes, if anything. Speaking of diabetes, we do really recommend this medication, and we will work with your family doctor in providing this and helping you. We collaborate with a lot of family doctors to achieve your goals. Your doctor may highly recommend this, but it's not affordable through Walgreens or your insurance. So people come to us, and over the few months, they see their A1C dropping, and then their family doctor, they adjust their insulin. They adjust their metformin or their Tirzepatide or anything like that. We do not adjust your medications. Sometimes we do recommend or have you tell your family doctor a note saying that they are aware that you're taking this on top of everything, because we don't want you to have your hemoglobin A1C will decrease, your lipid panel will decrease, and we don't want you to be over medicated with other medications that drop your blood sugar. So you cannot be pregnant breastfeeding, you cannot have pancreatitis, and you cannot have a personal or family history of thyroid cancer. That's another big one. It's one specific, it's a hereditary one, but if you don't know or if you have questions, we will have you get the papers from your first degree relatives. So that's either a mom, dad, or a sibling. We want to make sure you're healthy. Well, people will say, well, there's no studies that any human has gotten this thyroid cancer. Well, of course not, because we do our due diligence in making sure we're not giving it to clients who have a history of hereditary thyroid cancers. But in studies, rats did develop hereditary thyroid cancers. So we have to be safe, and that's a no-go too. We also do not give it to people who are alcoholics that consume more than one alcoholic beverage a day, because that's putting your pancreas at risk again. While there are studies that it is treating fatty liver and alcoholism, because it doesn't make you want to drink anymore. It decreases your appetite. So they're all doing new things with this. And the next newer one that we hear about is type 1 diabetes. While we've had a lot of endocrinologists prescribe it to them, at this time, we are not prescribing it to anyone type 1 diabetic. It is not within our realm at this time, and it's not FDA recommended. So we will wait and wait for further studies to go on. Just to recap what Tirzepatide is, it's a compounding medication. So we receive our medications from pharmacies that are FDA approved. We have to do that. That's the law. But each medication is made, and each medication cannot be monitored. Therefore, the medication itself is not FDA monitored. Yes, the FDA knows about it, but you have to get it from FDA compounding pharmacies. That is very common for people who've gotten creams or estrogen. You've gotten it from maybe a compounding pharmacy, but the medication itself is not FDA regulated. So we are compliant, we are up to date. And the last thing I will hit on is buying online. There's lots of people that are buying on Groupon, buying online. It says do not tested on humans, not tested on animals. You don't know where you're getting your medication. It's not safe. If you tell us that, we are not going to take on that liability if you want to switch to us. We also have a rule that if you come here, you stay here. If you leave and come back, we probably won't take you back, unless you said, oh, my insurance paid for it, but now they are no longer. Why? Because it's a liability on us. You went down the street, you got your friend's medication potentially, you got Canada's medication, China, wherever it was. I don't know what you injected. That way, if you have a side effect in 1 week, 1 month, 1 year, 10 years, and I was one to giving you some and you were getting it from somewhere else, we don't know. It's a liability for us and your safety. So I do recommend going to somebody face-to-face, someone telehealth, someone brick and mortar that you can trust to get your medication that uses FDA-approved pharmacies and pharmacy license. So if you guys would like to know more about Tirzepatide or any of our weight loss medications, you can give us a call at 937-204-3390. Thank you so much.